Hello, my name is Anna Batista, and I'll be presenting my case. I did my fieldwork rotation at an outpatient pediatrics site called Palm Beach SOS with OT Kelly Gerbach. So for my child, she was 3 years old and 8 months. She was born full term, normal delivery. She was diagnosed with a speech delay and dysphagia, and she was under precautions for gagging on food. For as far as her occupational profile, she lives in a house with her parents and 7-year-old sister. She goes to preschool. She likes to play with blocks, puzzles, coloring, Disney princesses, educational games. So she was assessed through different assessments, both standardized and non-standardized. So standardized, she had the Bailey scales and then the sensory processing measure second edition. So for the Bailey scales, it was um, informing us that she had poor in-hand manipulation skills, decreased hand strength, as far as fine motor, and then for gross motor, she has poor postural control, coordination, force grading, especially when kicking a ball. And then for the sensory one for SPM, we noticed that she had moderate difficulty with all different sensory systems, including planning and ideation. And then for semi-structured and unstructured free play observations, we noticed that she tends to say yes to all the questions, whether they're correct or incorrect. So she would benefit from being prompted with open-ended questions. As far as developmental milestones, she is delayed on most of them. She is functioning at a level of about 1 to 2 year old when she's almost 4. Um, so for her ADL's current function, she requires maximum assistance when it comes to dressing and fasteners, some toileting. She can do hand washing with a little less help. And then as far as feeding, she has a really bad time feeding herself. She would only do it with one type of food and is very rigid about it. And everything else she is unable to do, such as like using utensils or drinking from a cup. As far as her goals, her first long-term goal would be to work on her postural control really when it comes to using swing games to do so. And then the second one would be to work on the fine motor to be able to function with ADLs like donning socks. As far as interventions I could think of for the goal of the postural control, she can work with a balloon toss game while being on a swing that would work on her posture, and it would give her demands outside of like her um, stability, her core. And then for goal two, the intervention would be to participate in a treasure hunt game with their putty where she has to manipulate it and find little pieces of jewels or beads, working on her fine motor control and manipulation of the hand. And then as far as the parents, I would communicate to them that it's important for her to be encouraged to try putting on her shoes and her socks on her own, to model it for her and give her a chance to try it. Also being playful with different types of foods so that she can be comfortable around them and eventually want to try them herself. And then ask a lot of open-ended questions, not so much of yes/no questions to continue developing her speech. Try to encourage playtime while sitting crisscross or in a swing to work on that core strength and posture. And then at home, to try to have her interact with toys that are smaller. That way she uses a lot of finger dexterity and in-hand manipulation. And that is my case.